It's the festive time of year when the consumption of wine, beer and spirits climbs to new heights. Alcohol might be seen as a social lubricant, but it's recently been ranked as the most harmful drug to society, above heroin and cocaine. The cost of Australia's addiction to alcohol has been measured at more than $15 billion. This amount takes into account the cost of community policing, hospital emergency rooms, as well as individual health. Alcohol is now responsible for almost half of all admissions to drug rehabilitation clinics. Those addicted say the road to recovery would be much easier if there was a cultural change in the attitude towards booze. Bronwyn Herbert reports.
It's an annual rite of passage. It's also when the full fury of alcohol-fuelled violence hits. Nowhere is it more evident than in the emergency wards of hospitals around Australia in the early hours of the new year.
The very fact that you stabbed yourself is of concern. You know, what should stop you from going off and doing it again? The problem is that when you came in here, you were upset, you were angry, you were drunk. And we were worried about your belly. And you had quite a deep wound in there, and we were worried that you hit something important.
It's an emotional time of year.
Yep.
I'm not a self-harmer.
Dr Andrew Fink, who leads the emergency ward at St Vincent's Hospital in Sydney, says there's a constant stream of intoxicated people.
You come on a Saturday or a Sunday morning and you can smell the alcohol, you can smell the blood, and you can see a line up here of people in cervical collars all waiting to be either imaged or with CT scans of their heads and their necks, or just waiting to sober up enough so that we can clear them clinically.
And now more than ever, these patients are young women. Far away from the party scene is the harsh reality of Australia's growing addiction to binge drinking. On Sydney's southwestern outskirts is Odyssey House, a rehabilitation centre set up more than 30 years ago, focusing on drug and alcohol abuse.
What alcohol have you been drinking and how much each day?
Per day it's normally been at least 1 to 2 bottles.
Sharon Meston leads the withdrawal unit.
What sort of spirit?
Bourbon, mainly.
New patients are assessed and staff draw up a plan for a medically supervised withdrawal.
Duncan, your blood pressure's okay, but look, your sugar levels are a little bit too high.
Here staff are acutely aware of the physical harm caused by alcohol addiction.
Someone coming off heroin can come in and be completely, free of the drug from their blood system within 7 days. Alcohol's not so kind. It's a much harsher drug to be coming off. Far more, damaging long term.
32-year-old Finbar tried to go cold turkey at home, but after many failed attempts, he realised he needed professional help.
Alcohol is actually physically the most dangerous drug to withdraw from. It's one of the few that you actually can die from while you're physically withdrawing from it.
Patients are encouraged to confront the reasons why they turn to alcohol. For Finbar, it was to hide his own social anxieties, and drinking was part of family life.
The first alcoholic drink I was actually given to me with permission by adults was when I was 11 to celebrate an academic achievement.
By the time Finbar was at university, his drinking habits had grown into a major problem.
I wouldn't be able to go down the road to Coles and buy a loaf of bread or, talk to the cashier or something without being at least slightly tipsy. At the height of my drinking problem, I would be consuming about 3 litres of cask wine at home, on and off during the day and when I got home. But also if I was going out, then I'd be consuming like 8 or 9 schooners of beer as well.
At Odyssey House, once a patient is medically free of alcohol, a year-long rehabilitation process begins. Patients live simply and have to earn their keep. working in the garden and cooking bulk meals. It also includes months of group therapy.
I think everyone in this room has probably heard like someone say, well, why can't you just stop it? You know?
Don't go to the pub, don't go to the bottle shop, just stop. Yeah, right. Don't buy it. To everyone else, it's as simple as that.
It's like your crutch in life, you know, it's the first thing you grab instead of going to talk to someone about your problem. I used to turn to them and drink. Drink from the point you'd wake up in the morning to the point when you pass out of a night.
You know, for me it is sort of a set time that I thought was okay. So it would be after the kids got home from school or when my husband came home, and I thought that made it sort of acceptable.
So how difficult is it to stop drinking?
It's hard because it's so cheap and easily accessible to, yeah, it's everywhere.
The amount of people that their lives are affected by alcohol, people letting loose on the weekend, it's the most ridiculous, I don't know, it's like a social lie in Australia that everyone just says because it makes it easy for us to go out and get hammered and do what we want. But the truth is, it's not good and it's not safe.
Finbar says his addiction threatened to destroy his marriage.
Whether you like to admit it or not, I think the substance that you're addicted to takes precedence over your family, your job, and in the end, I think your partner.
But he hopes this year-long rehabilitation will pay lifelong dividends.
Yeah, it's an investment in my future because I could have spent many more years stuck in the same rut of alcoholism, or I could have just set aside 1 year to really do something about the problem.
Increasingly, patients at Odyssey House are trying to recover from an addiction to alcohol.
In 2007, we saw for the first time that people who nominated alcohol as their primary drug of concern superseded illicit drugs like heroin, cocaine, cannabis. And certainly that trend has continued so that now over 35% of the people who come into the program last year actually nominated alcohol as their primary drug of concern. So this is certainly a big change for us.
Drug experts say that recent studies have shown that Australians are drinking more alcohol now than at any point in the last 20 years, and that's because of changing consumer habits.
In fact, because of the increasing alcohol content of wine and because we are actually consuming more wine, we are actually consuming more now than at any point in the last 20 years.
Professor Steve Alsop heads the National Drug Research Institute at Curtin University in Perth. He says despite the government's national drug strategy, plenty more could be done to curb the country's addiction.
It is amongst our more harmful drugs. Many people don't want to hear that. Many of us enjoy alcohol. But we've also got to recognise that alcohol has substantial potential for harm.
Professor Alsop says easy access to alcohol is part of the problem.
How we make alcohol available in licensed premises and indeed at home, how we promote alcohol, all these things have a significant impact on the amount we consume and the amount of harm in our community.
And that message is echoed by those on the front line.
We've got kids under the illegal drinking age here tonight, and they've clearly been able to access alcohol, so that needs to be looked at, how they're getting alcohol and who's allowing them to drink. But we're seeing all ages here as well who are not taking heed of the message that alcohol is a dangerous drug and you need to take care with this sort of drug in any situation.
That report from Bronwyn Herbert.